Hello everyone, this is Dr. Preetimala from Apollo Fertility Borivali East, and today's Facebook session is about male factor infertility. Male factor infertility, one of the very important parameters of the fertility OPD. What we see is male factor infertility. Nowadays, the incidence is going on increasing, maybe because of the lifestyle factors, maybe because of the addiction factors, stressful lifestyle, hectic working schedules. What is comprising a part of a infertility couples? Okay, so total out of the infertility patients, around 40% couples will have male factor as a cause of infertility, and the most important investigations what we do when the patient or if the couple is coming to the OPD, we advise them to do a semen analysis. Okay, so semen analysis is a testing of semen sample, and the most important three parameters what we assess is the count of sperms. The second thing is motility, and third thing is morphology of the sperms. Around 2% of reports of semen analysis will have some abnormality in the semen analysis reports. So, what is the normal sperm count taken as? Normal sperm count क्या होता है? अगर कोई कपल देखना चाहता है कि ये suppose the sperm count is around 14 million या फिर 20 million या फिर 25 million. So, what is a normal sperm count? So, according to the WHO criteria, 15 million sperm count is taken as lower limit for the normal sperm count. Anything below that is taken as a abnormal sperm count. Okay, obviously, when we were maybe 5 years back or 10 years back, this standard or reference range was quite high. But then, right now, what we take it as a normal sperm count is a 15 million per ml is considered as normal sperm count, and anything below that is considered as a lower sperm count. What we call it as oligospermia. Okay, what is a normal motility of sperms? Around 42% of motility of sperms is considered as a normal motility, and the different division of a motility is done as rapid progressive, then sluggishly progressive, and non-motile. Okay, so the low sperm count is labeled as oligospermia. uh, Low motility is labeled as astinospermia, and obviously zero sperm count is labeled as a azoospermia. Fine. What are the other parameters what we assess other than semen analysis? If you see that the normal count of a patient or normal motility of a sperms or normal morphology. Yes, again, morphology is the third parameter, which is very important part of a semen analysis report. So, around 4% of sperms are supposed to be normal according to the semen analysis standards of WHO guidelines. So only 4% sperms are normal, and 96% of the sperms, even if they are abnormal, it is labeled as a normal semen analysis report. Okay, so nothing to get panic. बहुत बार पेशेंट पैनिक हो जाते हैं कि मैडम सिर्फ 4% स्पर्म्स नॉर्मल है तो 96% abnormal है. So is it a very critical report, or is it a very critical situation we should be worried of? So no, nothing like that. So for 15 million जो sperm count है वो normal sperm count है. 42% मोटिलिटी जो है वो नॉर्मल मोटिलिटी कंसिडर किया जाता है, और जो 4% जो मार्फोलॉजी हम लोग होते हैं वो कंसिडर किया जाता है एज अ नॉर्मल मार्फोलॉजी ऑफ अ sperm. Okay, so what are the other tests what we do? There are many sperm function tests available in the market, or available in the laboratories, but not many of them will give you a conclusive result which helps you for a line of management. But yes, the most important parameter what we see is DNA fragmentation index, which is a very important parameter, especially for IVF patients, especially for patients with recurrent IVF cycle failures, recurrent abortions. Okay, so basically recurrent fertility failure, DFI, DNA fragmentation index, which is done for the husband or male partner, is considered to be a very crucial parameter. Around 25% of DNA fragmentation or lesser than that is considered as good fertility potential or excellent fertility potential. After that, between 25 to 50, and then 50 more than 50 is considered as a good to fair, and then poor fertility potential. Okay, so डीएनए फ्रेगमेंटेशन इंडेक्स इतना फ्रीली अवेलेबल नहीं है, लेकिन कुछ स्टैंडर्डाइज लेबोरेटरीज है जहाँ पे अब ये काफ़ी अच्छे से काफ़ी इजीली अवेलेबल है, और जो कि अपने पेशेंट्स को ट्रीटमेंट के लिए हेल्प कर सकते हैं. Okay, so we like to do DFI in patients who are having asthenospermia or who are having morphology problems in the sperm count or low sperm count, or जैसे मैंने बोला recurrent fertility failure, recurrent IVF cycle failure, recurrent abortions. Here DNA fragmentation index is really playing a good role, and most of the times this is because of the reactive oxidative stress, because of which DFI levels may be high. So accordingly, we give medications to the patient, like we give supplements, sperm tonics, and we give antioxidants to the patient for the period of say 3 months. After which we again retest the semen analysis and we do the DFI again to see whether there is any improvement in the parameters of the sperms. Okay, low sperm count people with low FSH levels may be given tablet cyphine, which will improve the FSH levels in the blood and cause improvement in the sperm count of a patient. सो सबसे पहले जब पेशेंट आता है सीमेन एनालिसिस किया है, एबनॉर्मलिटी क्या है देखना चाहिए. डीएफआई अगर होता है तो बहुत अच्छी बात है. डीएफआई थोड़ा एक्सपेंसिव टेस्ट है, सो नॉट मेनी पीपल may afford, but yes, obviously if it is possible please get it done, because that is going to help you for the further management of a fertility treatment. ओके, सो बाकी अगर जो भी पैरामीटर्स है जैसे मार्फोलॉजी के प्रॉब्लम से या मोटिलिटी के प्रॉब्लम से या स्पर्म काउंट के प्रॉब्लम से, तो उसके लिए जो हम देते हैं एक तो हार्मोनल टैबलेट्स या हार्मोनल मेडिकेशन दिया जाता है टू इम्प्रूव द एफएसएच लेवल्स इन द बॉडी एंड ऑब्वियसली टू स्पर्म प्रोडक्शन इन द टेस्टिस. Second thing what we give is sperm tonics, which is going to improve the motility parameter of a sperm and the fertility potential of a sperm. Obviously, antioxidants are fantastic, and if you give it for sufficient period of a time before you give treatment, I think it is really going to help you to get better sperms for the fertilization, whatever it may be, maybe IUI or IVF. That is going to improve the fertility potential of a person. But then obviously the patient has to have a good compliance of taking the medication and has to be given for at least a period of 2 to 3 months. And then we retest the semen analysis again, and then we go ahead. Okay, so what about the zero sperm count? What we are really, what the couple is really worried of, अगर zero sperm count है तो वो बहुत पैनिक हो जाते हैं. डॉक्टर स्पर्म्स नहीं है तो अभी क्या किया जा सकता है. वी वांट दी बेबी फ्रॉम आवर ओन सोर्स ओनली, फ्रॉम आवर ओन जीन्स ओनली. तो क्या कर सकते हैं. डेफिनेटली वी डू हैव आंसर फॉर दैट. सो कोई भी पेशेंट जब अजूस्पर्मिया का रिपोर्ट लेके आता है, फर्स्ट ऑफ ऑल वी शुड रिपीट इट. ओके, सो नॉट ऑन अ single semen analysis report we cannot label a patient of having a zero sperm count. So definitely we should have at least 2 to 3 semen analysis report, and the parameters should be considered, like whether the patient is giving semen sample properly, whether what is the abstinence, और वो कभी कभी पेशेंट्स कंडोम सैंपल लेके आते हैं जिसमें अजूस्पर्म या डेड स्पर्म्स मिल सकते हैं, तो दैट इज़ अ मिसलीडिंग रिपोर्ट. सो पेशेंट को ठीक से गाइडलाइन देना चाहिए कि जब आप सीमेन कलेक्शन करते हैं तो फर्स्ट ऑफ ऑल इट शुड बी स्टेराइल कंटेनर. The abstinence should be of 2 to 3 days, and it should not be a sample collected in a condom, because that is containing spermicidal jellies, and that is going to mislead us with the reports. Okay, so then third thing what we tell the patient that they should not apply anything like sanitizer or soap before they give a semen sample, because that may again affect the sperm count or sperm parameters, because obviously that is containing chemicals and that is going to affect the sperm count. So ये सब इंस्ट्रक्शन पेशेंट को देनी चाहिए. ऑब्वियसली देखना चाहिए कि पेशेंट को कोई पास में कोई इन्फेक्शन है या फिर कोई वैरिकोसिल की हिस्ट्री है, हाइड्रोसिल की हिस्ट्री है, वेदर ही इज़ मेडिकली फिट, ही इज़ हैविंग डायबिटीज़ विद अनकंट्रोल्ड शुगर्स, हाइपरटेंशन ऑन मेडिकेशंस. ये सब चीज़ें पहले देख लेनी चाहिए before we go ahead with the management of any suboptimal parameters of sperms. Okay, so very important to take medical history of a husband. बहुत बार हम लोग देखते हैं कि फीमेल को ही हम लोग ज़्यादा इवेल्युएट करते रहते हैं, फीमेल के ऊपर ज़्यादा स्ट्रेस करते हैं कि ये देखना चाहिए वो देखना चाहिए, लेकिन many a times the husband is many a times under evaluated. So that should not happen, because male factor obviously is a very important parameters and responsible for 40% infertility. Okay, so very important to evaluate the husband properly, including semen analysis, including DFI, if required sperm function test. The medical status of a husband should be evaluated. He should be evaluated for hemoglobin, he should be evaluated for sugars, he should be evaluated for liver function test if he's having history of fever in the past. Okay, so all these things should be properly evaluated. एंड ऑब्वियसली वन यूएचजी स्क्रोटम, स्क्रोटम का अगर हम अल्ट्रासाउंड करते हैं तो उसमें कोई कलेक्शन जैसे हाइड्रोसिल है, वैरिकोसिल है, ये या फिर कोई इन्फेक्टिव कलेक्शन है, सो ये सब चीज़ें हमें समझ में आ जाती हैं. देन अकॉर्डिंगली वी कैन ट्रीट द पेशेंट विथ एंटीबायोटिक्स, वी कैन गिव द पेशेंट रिक्वायर्ड मेडिकेशंस जैसे स्पर्म टॉनिक्स है या फिर हॉर्मोन्स है या फिर हम जो एंटीऑक्सीडेंट्स देते हैं. ओके, सो दिस इज गोइंग टू गाइड यू प्रॉपरली एंड इट शुड बी अ टारगेटेड ट्रीटमेंट rather than giving everything. Okay, so very important, first of all, history. Then second thing, a history of addiction. Third thing is evaluation of parameters, evaluation of all the parameters properly, like diagnosis. We should lead to a diagnosis before we prescribe any medication to the patient. Very important. अभी अगर अजूस्पर्मिया है पेशेंट को तो ऑब्वियसली हम हॉर्मोन्स इवेल्युएट करते हैं. व्हाट आर द इम्पॉर्टेंट हॉर्मोन्स इवेल्युएटेड? वन ऑफ द मोस्ट इम्पॉर्टेंट हॉर्मोन इज follicle stimulating hormone, FSH in a male, very important. अगर sperm count 0 है, because that will help us to know whether this is a obstructive azoospermia or a non-obstructive azoospermia. क्योंकि अगर कोई स्पर्म सीमेन में नहीं है तो हम लोग टेस्टिस में से, मतलब जहाँ पे स्पर्म प्रोडक्शन होता है, वहाँ से हम लोग स्पर्म को निकाल के हम लोग आईवीएफ के द्वारा ऐसे पेशेंट को प्रेगनेंसी दे सकते हैं. ओके, सो वेरी इंपॉर्टेंट. फर्स्ट ऑफ ऑल, अगर अजोस्पर्मिया का पेशेंट आता है तो हम लोग पहले तो 2-3 बार उसको सैंपल को, मतलब we should do the semen analysis at different occasions and we should not rely on a single report first. Okay, because अगर कोई रिपोर्ट जीरो स्पर्म काउंट दिखाता है तो ये भी हो सकता है कि अगला रिपोर्ट completely normal हो. ओके, सो ऐसे केस में पेशेंट पैनिक करेगा एंड देन आई थिंक द ट्रीटमेंट should will go in the wrong direction. So instead of labeling a patient with a zero sperm count, we should repeat the semen analysis and then see whether the sperm count is coming as same or there is improvement in the parameters. Okay, उसके बाद में हम लोग ब्लड टेस्ट करते हैं. जैसे मैंने बोला आपको फॉलिकल स्टिमुलेटिंग हार्मोन, थायराइड स्टिमुलेटिंग हार्मोन और एलएच एंड टेस्टोस्टेरोन कर सकते हैं. प्रोलैक्टिन में भी इन सम केसेस. सो एफएसएच, एलएच, टेस्टोस्टेरोन एंड प्रोलैक्टिन. ओके, टीएसएच ऑब्वियसली. सो ये सब हार्मोन इवेल्युएट करने के बाद हमको जो जीरो स्पर्म काउंट का जो रीज़न है या डायग्नोसिस है वो समझने में आसानी होगी. अगर ऑब्स्ट्रक्टिव अजोस्पर्मिया है, व्हाट obstructive azoospermia is a azoospermia of a kind in which there is a sperm production in a हाँ. So obstructive azoospermia is a azoospermia where there is definitely a sperm production in the testes, but because of some mechanical obstruction, the sperms are not coming out. So ऐसे cases में आपके FSH, टेस्टोस्टेरोन, ये सब हार्मोनल लेवल्स नॉर्मल होंगे. ओके, जो कि अपने लिए इम्पॉर्टेंट है ना. तो ऐसे केसेस में हम लोग टेस्टिकुलर बायोप्सी करके स्पर्म्स को निकाल सकते हैं. We can do fertilization with those testicular sperms, make embryos and transfer in the uterus of a patient. Okay, so दूसरा को बोलते जो स्पर्मिया है, अगर नॉन ऑब्स्ट्रक्टिव अजोस्पर्मिया है तो ऐसे केसेस में हमारे जो पेशेंट के जो हार्मोनल पैरामीटर्स रहेंगे जैसे फॉलिकल स्टिमुलेटिंग हार्मोन, टेस्टोस्टेरोन लेवल्स, ये सब अफेक्टेड होंगे. ओके, बिकॉज इट इज अ टारगेट ऑर्गन फेल्योर, प्राइमरी टेस्टिकुलर फेल्योर, एंड दैट्स व्हाई द ब्रेन विल ट्राई टू स्टिमुलेट द टेस्टिस विद इंक्रीज लेवल्स ऑफ हार्मोन्स. तो ऐसे केसेस में हम लोग पेशेंट को माइक्रोटीसा के द्वारा भी स्पर्म्स का रिट्रीवल कर सकते हैं, या फिर ऐसे cases में then we do have option of a donor sperm obviously, but that is a last resort as far as possible. Nowadays we successfully retrieve sperms even in cases of microtisa, even in cases of Sertoli cell syndrome where there is around 15 to 20% chance of sperm retrieval. Okay, so we do have hope for this patient, and obviously we do karyotyping for this patient to see whether there is any chromosomal abnormality because of which the azoospermia condition is diagnosed. Okay, so all these things very important. So I think male factor is the easiest thing to treat in cases of infertility. Here what happens is we do have many answers, like even if the sperm count is very low, we do have option of IVF, we do have option of ICSI, we do have option of IMSI if there is a problem with the morphological parameter of a sperm. So very important to do proper evaluation and then guide properly to the patient. Here at Apollo Fertility, we practice all these standard protocols for our patient to give the best treatment to the patient. Best evaluation will lead to best treatment and best results, obviously, to get the success in the treatment. So, any questions, Smriti? Do we have any questions? Yeah, so I think there are few questions like people have asked whether vitamin deficiency or some lifestyle changes will lead to a lower sperm count. Yeah, definitely. Your nutrition is going to affect all the parameters of your body, all the systems of your body, and I think sperm production is one of the system, and it is definitely going to get affected if the nutritional parameters are suboptimal. Okay, and obviously other lifestyle disorders like hectic work schedule or lack of sleep or hectic traveling or what you call it as working at a higher temperature. Okay, so all these things are going to lead to lower sperm parameters or suboptimal sperm parameters, and the correction of a lifestyle or what you call addiction, treating addiction is again very important. So this is going to definitely help to improve the sperm parameters and obviously going to lead to a successful treatment. Yeah. So other questions are like if the female is perfectly fertile with a will lower sperm count in the male affect the pregnancy process? Yes, obviously. जैसे मैंने बोला कि अगर female factor, male factor, and obviously in many cases there are sometimes it is unexplained infertility, but definitely if it, even if the female is totally fertile and the sperm parameters are suboptimal, it is definitely going to affect the fertility of a patient. Anything else, Smriti? Are we done with the questions?
Ma'am, there are questions I'm posting. If you can check.
Do we have more questions? Yeah, so it is it true that radiation from electronic devices affect the sperm count, and how many sperms are inseminated during the IVF process in case of low sperm count? Yeah, so yeah, definitely the overuse of electronic devices like mobiles, laptops in the vicinity of a private parts is going to affect the sperm parameters definitely, and radiation, any kind of radiation is definitely going to affect the sperm count. So just this is a part of what you call it as occupational hazard, you can call it as. Okay, many people they're working in the factories with the excessive chemical exposure, जैसे dye industry हो गया या chemical industry हो गया या फिर working in the factories, definitely going to affect the sperm count of a patient. Anything else, Smriti? Do we have questions? Questions is never come.
हेलो.
Hello.
हाँ मैडम, मैं
So we do have like what lifestyle changes should one bring to improve the sperm motility, and do fertility medicines for men cause any negative side effect? Yeah. So the question asked is, do fertility medicines affect? Do they have any side effects on the other systems of men, or any change in the lifestyle is going to improve the sperm parameters? Yeah, definitely. As we discussed, if we stop the addictions, if we plan the work schedule, if we avoid hectic work schedules or unplanned schedules, we can call it as. Okay, so taking food on time, work on time, sleeping on time, avoiding excessive use of electronic devices. Okay, wearing cotton pants. Okay, no tight undergarments. Okay, avoiding excessive exposure to the heat, definitely going to improve the sperm count. Okay, very important. So all these things should be taken into consideration. Lifestyle changes definitely, because the cause is lifestyle. Okay, if the cause is lifestyle, the treatment is lifestyle change definitely. And because the what you call effect has happened over a period of time, this is not like 2 days of exposure to the heat or 2 days of exposure to the electronic devices and the sperm count is going low. No, definitely not. It is happening over a period of months, happening over a period of years. So definitely it is going to take time. Give time to the lifestyle changes to give you the good effects. Okay, so addictions, most importantly, lifestyle changes, and those fertility medications do not have any effect on your other systems of the body. But obviously we evaluate the patients for liver function test, renal function test before we prescribe the medication to the patient, so that that should not affect the general health of a man. Okay, so I think we are done with the questions, and it was a fantastic session. Okay, and I hope this was helpful for our viewers to improve the awareness about the male factor infertility. I think we should end this session with this last question, and it was definitely. And it was definitely fantastic to interact with you, all of you. We are here at Apollo Fertility to solve all your problems. We are here to solve all your doubts and queries. So definitely come and contact us. Okay, yeah. Thank you so much, Smriti, and we should meet next week with some other topic. And uh, I think we should, thank you so much and have a good day. Yeah, thank you.